Hi there. I'm Kristie Trousdale, Deputy Director of the Children's Environmental Health Network, and I am joined by Will Rome, a graduate student at American University and policy intern with CEHN. And we are pleased to host this mini fireside chat with Laura Kate Bender, Vice President of Nationwide Advocacy and Public Policy at the American Lung Association. Laura Kate, along with her colleagues Diana Van Vleet, Liz Scott, Shyamala Rajan, Natalia Reyes Becerra, and Emily Thompson, lead the Healthy Air Partners Coalition, a group of national public health, medical, nursing, and healthcare organizations. The coalition advocates for measures to improve our nation's air quality and mitigate climate change. The Healthy Air Partners team is the 2025 Policy Awardee for CEHN's Child Health Advocate Awards. So I welcome viewers to read more about the Healthy Air Partners Coalition on our website, because we are going to dive right into this little chat. So the first question is just a super fun one. But Laura Kate, as a busy professional, I'm very curious to know if you could have an extra hour in the day, what would you do with it?
I can give you the honest answer and the aspirational answer. The aspirational answer is I would probably use it to read more. I spend so much time reading emails. I listen to a lot of podcasts, but I have not finished a book in some time. I would love to have a carved out hour to read a book. In practice, I would probably use it to check more emails.
Yeah, I like your, what you really would wish for, your honest answer. And I'm glad I didn't ask you. My initial thought was to ask you, what is the last book that you've read?
It was a children's book to my kids.
I get that. I love it.
All right, and I'm honored to ask the first question. And so the Healthy Air Partners team connects the public health and healthcare sectors in advocating for clean air and climate initiatives. Can you speak to the sustainability of this coalition and why these issues must be addressed by public health and healthcare professionals?
Absolutely. So the very quick history of this coalition, it predates me, but well more than a decade ago now, the Lung Association thought that we needed to have a carved out space in clean air and climate policy and advocacy for the health community. A lot of people perceive this as an environmental issue. Obviously, it's also a critical health issue. And having a place for health organizations to come together, tap into shared resources, and speak with a unified voice on these topics that's coming from the health community, whether it's providers, healthcare professionals, public health groups, or other health-focused groups, has been really helpful. It's helped build the coalition over time. It's helped given groups an opportunity to weigh in on issues they might not otherwise have dedicated capacity to track. And so my hope is that the coalition and other efforts like it that have built more health involvement in these issues will mean that it sustains for a long, long time to come. That now lots of groups are engaged in this work on climate and clean air advocacy from a health focus, and because it clearly benefits all of our missions, we'll be able to keep doing that.
Awesome. Thank you, Laura Kate. And I know we at the Children's Environmental Health Network so value the coalition and all of your expertise that you bring and all of the hard work behind the scenes to get us all up to speed and organized. It's just been a valuable part of our work on advocacy for children's health. So with federal protections under attack right now, there's just so much going on, right? So how do you strategize? What is the Healthy Air Partners team doing to resist these changes and keep environmental regulations surrounding air quality as strong as possible?
The team here has been trying hard to keep focused on the places that we think we can best engage. As you mentioned, there is no shortage of things to engage in, crises to address when it comes to environmental health. We could get pulled in a million different directions, so we're trying to stay focused. So number one, the coalition focuses at its core on federal level protections. So we are focusing on making sure that there's a strong health response to proposals and other changes at the federal level on the policy front that are rolling back clean air protections, whether it's working with the coalition members to have folks testify at EPA hearings about why we shouldn't roll back clean air rules, making sure the media understands the health implications of some of the lack of enforcement that we're seeing, educating Congress about the need to continue having these protections in place. This is where we've built up our strength over the years. And so we don't want to stray from that because lots of people are doing it. We need to keep doing it, even if it doesn't always seem immediately effective in the way we would like. And then I think, our coalition, as we've seen over the years, has a lot of strength in what we can educate, whether it's healthcare professionals or the public about. So prioritizing work that makes sure that even as we're pushing in, the official capacity on the federal government to not roll back clean air protections and not reverse climate progress, that we're also using each of our platforms to amplify to the public. These protections are important. Clean air is good for you. Dirty air is bad for you, and climate change is bad for you. Here's what you can do, whether that's taking policy and advocacy action or even steps to protect yourself. And I think we'll be doing more of that in the months to come, just because we know that even though, currently we're seeing lots of rollbacks at the Environmental Protection Agency, we know the public still cares about this. And more importantly, we know the public is still feeling it. Kids are still feeling these impacts, and we need to keep giving them the tools to address them.
And continuing with that sentiment, because the Healthy Air Partners Coalition is so huge and broad and has so many different types of stakeholders, what can they do or other concerned parties at state and local levels to shore up air quality regulations and climate resilience, especially in regards to children's health?
Yeah, there are real opportunities at the state and local level. And how I've thought about this as the coalition, because we're federally focused, but we can always be a connector. There are lots of groups in the coalition that have state level chapters. The Lung Association has advocacy staff coverage in every state. We can help link up folks so that if there is something critical happening in Washington, that we can make sure that the people in Washington who are working on that are talking to each other. I think the other thing I'd say is that, we are a health community, obviously. Our partners in the environmental community are also leaders on this advocacy. And we can plug in together and then speak with separate voices. So if there is a local environmental effort on an opportunity to keep a polluting source from expanding or strengthen a clean air protection, the health community can engage in that too, and we can do it with our health voice. Whether it's sending letters to decision makers or educating the public or those in our audiences about why they should care about something they might perceive as an environmental issue. It's our issue too.
Great points, Laura Kate. Appreciate that. So this year, CEHN has hosted a series of advocacy trainings for child health champions. And I'm curious what your advice would be for these trainee champions. What do you think is the most important thing people can do to inspire change and equity surrounding children's environmental health in their communities?
I went to a Children's Environmental Health Network event a couple years back where there was a panel of youth advocates. And one of the ones I found, it was all very memorable. It stuck in my head because of the power of their personal stories, which we know works on everyone, including decision makers. So those stories are critical. And these are folks best equipped to tell those stories. But one of the things I most remember is one of the advocates talked about how integrated his view of environmental health was. I think I work at the American Lung Association. We think about air and climate. I tend to think in buckets based on what law regulates the issue I'm trying to think through how to work on. And he described a very different view of environmental health, which is, from the moment he wakes up, he needs a safe way to walk to school, free of violence and, safe for pedestrians. He needs clean water at his drinking fountain in the classroom. He needs safe classroom spaces that allow him to learn. He needs clean air indoor and out. And it just reminded me that the public does not see these issues the way I see these issues working where I work. I think, it's a really powerful opportunity to help people see the connections between environmental health issues and outcomes for kids, that we all want to have good outcomes. So I think, kids are can be powerful storytellers. Youth are powerful storytellers. And they also bring a perspective that I would easily forget about in my siloed world at work. I think also just, I'm truly in awe of some of the youth advocate voices that have risen, tend to rise above the clatter and the noise of, the policy debates sometimes. I was at an event this week where, it was an indoor air quality event. There were fabulous speakers across 4 different panels, experts from all over the world on indoor air quality, sharing stories about the harms. But the speaker that got the standing ovation was the youth advocate because of her passion and because of her commitment to the issue. She was the one that got us all to our feet.
Yeah.
Well, and just a note to end on, we really wanted to congratulate you, Laura Cade, and your colleagues at the American Lung Association for your advocacy and leadership within the Healthy Air Partners Coalition. And it's essential to fight for clean air and respiratory health for future generations. And you and your colleagues at the ALA are an exemplary champion of clean, healthy air. And we really do appreciate and do take the honor to give you the policy award for this year.
Well, we are very honored and pleased, but a coalition is only as strong as the groups that make it up. And the reason this coalition is successful is because of groups like Children's Environmental Health Network and many, many others that dedicate their time and their expertise. It is truly a team effort.